Firstly, ensure you have all of the equipment required, checking expiry dates for each item. The equipment includes a silver dressing trolley, 500ml pressure bag, 500ml saline, drug additive label, vamp pressure monitoring set, dressing pack, 2% chlorhexidine wipe, needleless shielded cannula, arterial blood syringe, vacuette, blood bottles, and a red bung. Once you have obtained everything you need, ensure the trolley is cleaned and wash your hands. Put on your PPE and prepare your trolley, remembering your aseptic technique. First, close the reservoir plunger. And then spike your bag of saline. Please make sure that this has been checked by 2 qualified practitioners. Fill the chamber and then pull the blue toggle to prime your line. Once primed, attach to patient after checking your red line clamp is closed. This will be no longer aseptic after this. Place the saline into a pressure bag and inflate. The transducer set and saline should be changed every 3 days. Don't forget to label your pressure bag with your saline so people know when it went up. Now you can prepare to move on to zero your line. Now check the monitor to ensure that the pressure cable is connected to it. Once you have confirmed this, attach the arterial line to the pressure cable. Check the screen of the monitor to confirm that the arterial line is connected. It will either come up as BP or ART and should appear with a red line. Click on the screen to prepare for zeroing. Going back to your arterial line, ensure that the transducer is placed in line with the heart for accuracy. Open the port to air by turning the stopcock away from the patient and remove the temporary bung, keeping the transducer in line with the heart. Going back to the monitor, you can now press 0. To confirm that the line has now been zeroed, you should see on the monitor that it says 0 confirmed. Now the line has been zeroed, you can reverse the process. Turn the stopcock back to the neutral position. Place the red bung where the temporary bung previously was. This helps to reduce any potential ports for infection. Taking blood from an arterial line. To take blood from the arterial line, you should follow the aseptic technique. Prepare your silver dressing trolley with the relevant equipment. This will include a dressing pack, 2% chlorhexidine swab, needleless shielded cannula, arterial blood collection syringe, vacuette, and blood bottles. Once fully prepared, following your aseptic technique, squeeze the flexures, and pull up the plunger to fill the chamber with blood. Close the valve. Clean the self-sealing sampling port. Attach the needleless shielded cannula with the blood collection syringe or with the vacuette onto the sampling port. Ensure that these are put on together and removed together, as otherwise the blood will flow freely. Aspirate the syringe up to 1 ml if taking an ABG. If taking bloods, insert the blood bottles to your vacuette. Once completed, remove the needleless shielded cannula and wipe the sampling port again. Open the valve and push the plunger down to return the blood to the patient. Flush the line by pulling the blue toggle until saline has fully flushed through the blood. If this is not flushed properly, there is a risk of the blood clotting in the line, which will require the line to be removed.